On behalf of Aster Hospital, today we are conducting a small social experiment to see how much people are aware of stroke. So we are asking the general public a few questions based on like what they know about stroke and how it is treated. So based on that, we'll get to know how much people are aware about this.
A stroke, according to my knowledge, whatever I have think is there's a sudden stop of blood supply to a particular area, like maybe a right side or left side, what it is done, and it comes to paralysis. That is what I think it is.
What we understand is it's a clot. Suddenly from the blood, if there is a clot in any part of the body or in the brain, suddenly.
Exactly, I don't know. I think it's something like I'm not sure.
ಯಾವ ಪಾರ್ಟಿಗೆ ಬರುತ್ತೆ ಫಸ್ಟ್ ಒಬ್ಬೊಬ್ರಿಗೆ ಮುತ್ತಿಗೆ ಬರುತ್ತೆ, ಒಬ್ಬೊಬ್ರಿಗೆ ಪಾರ್ಟ್ ಒಂದು ಕಡೆ ಬರುತ್ತೆ, ಒಬ್ಬೊಬ್ರಿಗೆ ಈ ಕಡೆ ಬರುತ್ತೆ, ಒಬ್ಬರು ಕೈ ಕಾಲು, ಒಂದು ಲಾಸ್ಟಿಗೆ ಬ್ರೈನ್ಗೂ ಬರುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರೆ.
ಆ ಸ್ಲೋಕ್ ಹೊಡೆದಾಗ ಮೂತಿಲ್ಲ ಸೈಡ್ಗೆ ಹೋಗುತ್ತೆ, ಕೈ ಕಾಲೆಲ್ಲ ಎಳ್ಕೊಳ್ಳೋದು ಆ ಥರ ಎಲ್ಲ ಆಗುತ್ತೆ.
So one particular parts won't work out, legs or hands.
Basically what happens is there's a seizure. You suddenly get a thing and your heart stops. That's what in a layman's term, yeah.
Simple, I guess it's like poor coordination, senses and limbs and all that, and then
No, I'm not aware of it. I don't know that.
ಇಮಿಡಿಯೇಟಾಗಿ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಹೋಗಬೇಕು. ಹೋದರೆ ಅಲ್ಲಿ ಒಂದು ಇಂಜೆಕ್ಷನ್ ಕೊಟ್ಟರು.
I try to give them a little punch on their heart.
ಇಲ್ಲ, ಆ ಥರದ್ದೇನೋ ಗೊತ್ತಿಲ್ಲ ನನಗೆ. ಈಗೆಲ್ಲ ಅದು ಆಯುರ್ವೇದಿಕ್ ಮಸಾಜ್ ಮಾಡೋದು ಆ ಥರದ್ದೆಲ್ಲ ಹೇಳ್ತಾರೆ, ಅಲ್ಲಿಗೆಲ್ಲ ಹೋಗ್ತೀವಿ ಆ ಥರ.
call the ambulance.
Today we conducted a small social experiment to know how much people are aware of about stroke. They didn't know like how they present like or the treatment aspect of it. Most of them didn't know. So maybe with this small experiment we have succeeded in at least educating a few people on what it is and what kind of treatment that is available for people with stroke. Stroke is the second leading cause of death in India after coronary artery disease. The incidence of stroke in India is about 100 to 150 per 1 lakh population per year. So what is stroke? Stroke is basically lack of blood supply to the brain. There are two types of stroke. One is ischemic and the other one is hemorrhagic stroke. So ischemic stroke is when a particular blood vessel gets clogged by a clot, and that cuts off the blood supply to one particular part of the brain. And hemorrhagic stroke is where a blood vessel breaks and starts bleeding, so it causes bleeding inside the brain. So the symptoms, coming to the symptoms of stroke, they can present like a facial droop on one side, or they can present with weakness of one side of the body, that is hand weakness, leg weakness, or they can present with sensory symptoms like numbness on one particular side, or speech difficulty. They won't be able to talk or understand completely. Or they can also present like sudden onset of giddiness and repeated vomiting or headache and so on. So when you see a person having these symptoms, so what you should do immediately is to get the person immediately to the hospital. As I told you, the ischemic stroke, this particular stroke has a type of injection which we call as TPA, which can be given in the window period, that is within 4.5 hours of onset of symptoms. Injection will try to lyse the clot inside the brain. So the effect is maximum when the patient is got within 4.5 hours of onset of symptoms. And the patient also, if the clot is quite big and it is in the major vessel, it can also be removed, which is called as mechanical thrombectomy. So if the people are aware of this particular treatment, they can also educate other people like within their surrounding, their relatives or friends, so that if they see a person with the symptoms of stroke, they can be immediately got to the hospital, and the recovery rate is better when this treatment is given immediately.